Hi, I'm Lauren Wilson, a realtor with App Properties. Born and raised right here in Central Indiana and a Hoosier through and through. Selling your home is a massive undertaking, and I completely understand what that is. That's why when you work with me, we put a great plan together to make sure that when your home comes to the market, it is in the best light possible. Again, I'm Lauren Wilson, 317-590-2290. 317-590-2290. Let's put a plan together and get your home sold.
Right now, everything's expensive. That includes things you need around the house. If your water heater, water softener, or well pump goes out, or even if your toilet stops working, you could be looking at a major expense. Don't let your next call to a plumber break the bank. Call John at Black Sheep Plumbing. John is a Hoosier lifer who takes pride in and stands behind his work. That's why all basic services and repairs with Black Sheep Plumbing come with a 2-year parts and labor guarantee, with water heaters having a 6-year parts and tank guarantee. Call or text Black Sheep Plumbing for all your needs today and speak directly with John, the owner. 765-315-7558. That's Black Sheep Plumbing at 765-315-7558.
Are you a Clay County resident who is ready to be part of creating a brighter future for our citizens? Doug Cobb is running for county commissioner and will bring fresh perspective to the table. A local farm and business owner, he has skin in the game of our county's success. He knows that a great team can accomplish so much more than any one of us alone and is ready to create a brighter future for Clay County together. The committee to elect Doug Cobb approves this ad. Paid for by Linda Cheesam.
Welcome back, Rob Kendall Show. Pleased to be joined in studio by Dr. Jim Dalton, CEO of Damar Services. How are you?
Good. Thanks for having me. It's great to be here.
You guys have been supporters of ours for a long time. You guys help support our State House Happening show. Before we kind of get into autism and what it is and what's going on with the kind of abuse in the system, which is really, really gross. You guys have been exemplary stewards of money that have been given to you for the years, and just kind of see what you think needs to be done to help people. Tell us about Damar.
Yeah, thanks for the opportunity. And always great to be here, and always great to see you. Damar,
person who says that.
Damar is a large not-for-profit organization centered here in Indianapolis, but provides services all over the state. We focus on, and our mission is to build better futures for children and adults facing some of life's biggest behavioral and developmental challenges. We focus on children and adults with autism and developmental disabilities and intellectual disabilities, and we do that across a full continuum of services from very high-level acute, early intervention, inpatient, outpatient, foster care, educational systems, all the way up to working with adults with developmental disabilities that they may need housing and things like that.
That's what's amazing to me is, and I tell people this, you guys go from everybody who may need some help like with their laundry or their checkbook to people who can't do anything for themselves. It's such a broad, just a broad range of people that Damar provides services for.
Yeah, we decided to create a system based on need that people could enter and exit our system at any time in their life, however they needed us. So we do have basic checkups for people that need a little bit of support, all the way up to 24-hour care for very intensive cases.
And I want to come back to that in a second, because it's one of the problems I have with how the state has cut the Medicaid funding for like the parent caregivers and things of that nature. So we're going to come back to that in a minute. But first, tell us about autism, because it's in the news all the time. Obviously, with Robert F. Kennedy Jr. being put in a position of prominence, that's become a conversation. Tell us what autism actually is.
Yeah, lots of questions about autism. Always has. I mean, last 10 years, I spent most of my time talking about autism, but autism is a neurodevelopmental condition. So basically, that said, it is a brain disorder that is evident in developmentally or when you're very young. So sometimes you'll see adults and they think, I have autism. Well, if you didn't have the symptoms when you were young, you don't qualify for the diagnosis of autism. But it really is a neurodevelopmental disability disorder that manifests itself very uniquely. It's usually very behaviorally based, communication and social skills. So these are delays, anomalies, atypical behaviors that are very unusual and very atypical. And we see those and we view those as a constellation of symptoms that we call autism. So it's always evident. In my opinion, it's evident very early in the first year of life. Sometimes it's not noticeable.
If your kid has it.
Yeah.
Somebody knows.
Yeah. Now, sometimes the misdiagnosis or no diagnosis. I talked to a family the other day, and my recommendation to them was, and my recommendation to everyone is, make sure you have a close relationship with your pediatrician if you feel, trust your gut. And they got some bad advice from their pediatrician. So that can happen too. But still, that is the best early intervention that you can do, is have good relationship with your pediatrician, talking to them about your concerns.
We hear about people say, well, the increases in autism.
Yeah.
Is there more? This is a horrible way to ask this, but is there more autism now, or are we just better at figuring it out? What has come with the result? Why has the end result been more autism diagnosis?
Yes and yes.
Perfect.
That's my thoughts and opinion, and I'm pretty confident in that. First of all, we're much better at diagnosing autism. 20 years ago, we were saying that kids with autism may have had ADHD or bipolar disorder or schizophrenia. We've just become better understanding what autism is, so we're better at diagnosing it, and that has increased the numbers. We've been more understanding of the subtle signs of autism, so that has increased the numbers. That alone, though, is not sufficient to explain the increase in autism. It has been my opinion and Damar's opinion for many years that in the human evolution, this is a period of time that we are seeing an increase in this disorder, this disability, that sometime will plateau and then will reduce. But we're not in that yet. So we are just seeing that. We don't know what causes autism.
I was going to ask, do you have an idea why there are increased cases of autism?
We don't know what causes autism. We should. Billions and billions of dollars have been spent on the research of what causes autism. We still don't know.
What's the holdup? Any idea?
Yeah, I think it's hard. I think the promising research is really it's a genetic condition that can be passed down. You know, there's a lot of information about twin studies and the features and the characteristics of parents when they come together. So that's the most promising. The best thing that we have with autism is we do know how to treat it. So that's the most important thing. We'd love to cure it one day.
Right.
And maybe that'll happen. I doubt it'll happen during my lifetime.
You guys would love to go out of business.
Oh, absolutely. I'd love to have zero folks with autism for sure.
Dr. Jim Dalton is our guest. He's the CEO at Damar. We're talking about autism. Have people like Robert F. Kennedy Jr. been helpful? Like, I mean, you hear it, they come out and go, the Tylenol and the this and that. Like, and some people go, well, that's not accurate. And you and I had this conversation last year, but
yeah.
Is it help? Are these conversations going on right now? Are they helpful? Are we getting better at it? Is care getting better? Like is all of this making it better to diagnose, to help with, to treat people who have autism?
Well, it's difficult for me to respond to that, but I will say this. I don't think there's anything that Robert F. Kennedy Jr. has said or the Trump administration has said that we haven't already known. What I do feel positive about is anytime the light is shown on autism and what it means for kids and families, I think it's a good thing. I don't think necessarily what he said has made treatment better or prevention better. I don't think that's happened, but I do think that the communities that we live in are more aware, and that's really the advocacy for autism is what big part of what Damar does.
How much does the internet affect things? Like I think about myself. So I have a 2.5-year-old, and when being a modern parent, like my parents didn't have this issue, but as a modern parent, you just read everything on the internet.
Yes.
And people are like, don't read the internet.
Yeah.
And, at 1 year old, my kid is a normal kid, right? And everybody's telling me that has had children. Hey, she's great. Yeah, but this kid over here is doing, the ABCs backwards and stop reading the internet. Like, how much have the freak out or obsession or whatever over autism, like, has the internet fed that because people are seeing about other kids and comparing their kids to other kids? Like, just walk us through that.
I think so. I don't.
I am the problem.
I don't have a lot of. I don't have a lot of good things to say about the internet, or especially social media. That has not been helpful for, really anyone. But particular information. I mean, there's really a wide spread of information, and it does make people think more than maybe they need to. I think there's some basic developmental features of kids as they develop that we want parents to pay attention to. Is a kid cooing and babbling by 6 months? Are they saying single words by a year? Are they putting 2 words together by 24 months? Those kind of things. When can they play peekaboo at a year and a half? If they drop their bottle on the floor at a year and a half, do they look for it?
Yeah.
Those types of things. And that's when we like the pediatrician visits early on to ask those questions and to make sure they're meeting those milestones.
Okay, so autism has been in the news recently in Indiana and other states because of abuse by providers. Yes. And can you walk us through a little bit? Obviously, you guys are not on that list, right? I want to be very.
We are not.
That's why I had you. I wanted you to come in because you guys do things the right way and really do help people and have just glowing, reviews.
Thank you.
But can you walk us through a little bit, just for the layperson, about how people may be abusing the system and what maybe needs to be done to try to clean some of this up? Because we want our money to be helping the most vulnerable, but we want to make sure it actually is.
Yeah. Well, first, I'll say in my response to that, I'm sad when I think about this. I'm also angry. And a lot of people are angry about what has happened and what we have discovered. As you know, Governor Braun put together a workforce earlier late last year that I had the privilege of being on, an ABA workforce, to look at what was happening. When we came together, there was a significant increase. I think in 2019, the state's Medicaid budget was for kids with autism was less than $100 million. 2023, 4 years later, we were almost at $640 million.
Wow.
Out of control. You cannot sustain that. So that's when he brought us together, and a bunch of good people saying, how can we provide quality care at the right Medicaid cost for so many of these children, and more entering the system. So we responded that way. Little did we know that there was abuse and fraud going into the system. And there were a lot of things happening. In 2016, the state was mandated to provide care, Medicaid reimbursement for kids with autism.
This comes from the federal government.
Yes. Yeah. There were no codes. So Indiana used behavioral health codes. They realized in about 2019 that wasn't the best way to serve this, the best way to fund it. The codes for individual counseling and things that didn't apply to kids with autism. That's not what treatment for autism is. So they began to say, hey, we need to look at this. We need to establish some rates. So we want our providers around 2019. We want to understand your rates, submit your rates. We're going to pay 40% of those of the rates, what Medicaid does to establish rates. COVID hits. There's not enough attention to it. There's a loophole. And what happened is that we had a few providers, for-profit providers. I don't know of any not-for-profit providers that engaged in this behavior, but several for-profit.
I think that's key.
It is. To me, it is key.
Because I think it's part of the conversation too, and not to equate these things, but I think this is interesting. The utility bills right now, who's in the spotlight? It's these for-profit utility companies that are making more money as they keep raising their rates. And that struck me. That's very similar. It's these for-profit entities. Yeah.
Now, I will tell you, I know a few for-profit entities that provide ABA services, and they are top-notch, and they are my friends, and they do a great job. But the abuse happened with for-profit providers. I'll give you an example. For an hour of ABA therapy that Damar provides today, we charge about $76 for that hour. And that includes the overhead, that includes the supervision of the staff. That is one-on-one treatment for a kid for that hour, constantly one-on-one behavioral training. Other providers, these providers that have abused the system, for that same service, for that same expense, they are being reimbursed. They have charged and been reimbursed about $800 for that same service.
Holy smokes. So you're talking, what is that, $730 more?
Yes.
An hour?
Yes. They were, Their loophole allowed them to do it. Lack of oversight in the past administration was unable to catch that. The Medicaid oversight was not sufficient enough. You had bad actors, and here we are.
Holy smokes.
Now, that all changed, but I can tell you, 2 weeks ago, it was still happening. It just stopped April 1st. Now, there are standard rates that we set in place. You can't do that anymore, but you could do that. And in 2023,
was there just no oversight? Like, how does that even happen?
It's unfortunate. The last administration, the heads of FSSA, of Medicaid, I know there's always a lot going on, but you gotta.
That's a big one.
Yeah, and I don't have a lot of sympathy for it, and I'm concerned about it. And I'm not even going to say I can understand how it happened, but
this is as mad as I've ever seen him. By the way,
well, it's good providers. Now, I'm not going to say we suffering, but children and families have less access to service now because of these bad actors. So the response of Mitch Robe and Governor Braun, I understand. I mean, I was in a meeting a few weeks ago with the FSA Secretary Mitch, and it was a tough meeting to be in because it's embarrassing for him, even though he didn't do it. And the governor, it was the past administration, but they are dealing with it now, and so it's been tough.
A couple minutes left with Dr. Jim Dalton. He's the CEO at Damar. So there's been a lot of talk and changes in parents, loved ones taking care of their severely disabled kids at home and the reimbursement rates.
Yes.
Parents are outraged about this. They say, hey, we take care of our kids better, or brothers or sisters or grandparents better than anybody else. Is there some middle ground that could be found on this? Because I've talked to a lot of people who are like, man, I'm worried my kid's going to end up in an institution. Yeah. Where are we at with that? Can we find something that works for everybody?
We hope that there is. I think there's a little bit of understanding of where can we cut costs? What are we trying? And I've seen firsthand the difficulties, the decisions that have been made. But these are tough decisions. I mean, these are really personal decisions to these families that have children that have significant disabilities that they no longer, now they have to go back to work.
Right.
Now they, and most of the time they are the best caregivers. So we're distressed by that. We're still working on that. And we hope there could be some middle ground, but it's a concerning time.
This is a thankless job you have being part of these committees. Why would you do that to yourself?
I'm honored to do it, but it's tough.
If people want to support your effort, because your money comes in from a variety of places, right? Some government, a lot of donations. You had that fabulous event that you always invite us. For some reason, you ruin your reputation. Let us come to your big gala event. How can people learn more about Damar, what you guys do? What do you need over at Damar?
Yeah, so we have lots of needs. Again, we do a lot. We have 1,400 employees, and we serve about 1,000. Today, I get a report every day of how many individuals we are serving. Today, we're serving 1,833 people. Our budget's about $140 million.
Holy smokes.
And we always need support. What Damar has tried to do over the years is to have programs like ABA where we can have a reasonable cost and have a little bit of money left over that we can paint the walls and replace the carpet when needed. We also need to do programs that don't make any money. Our adult living programs don't make it. Many things. And we've got ourselves to the point that we can, but we need the public support to continue to do that. Best way to find out about Damar, we have a wonderful website, www.damar.org. If you go to that website, you'll be astounded at the things that we do and the number of things. And you'll also be astounded by the number of people that we serve and that double that number still need our services. Yeah. And we still can't expand fast enough to do that.
Well, thanks for all you do. We appreciate it.
Thank you.
Dr. Jim Dalton, CEO of Damar. You're watching Rob Kendall Show.